All right. We are live. Hi, everybody. Welcome into Vaccine Questions and Answers. It's really an all-day effort here at Erie News Now to get some of your vaccine questions answered. I'm joined by Emily Shears from UPMC Hammett. She's the Director of Infection Prevention. Going to be answering as many of your questions as she can to her knowledge. Obviously, you can only speak to UPMC and what you folks are doing there. Talk a little bit about your vaccination efforts, who's been vaccinated, and what the rollout is looking like over at UPMC.
Yeah, so really about mid-December, we received our first doses of vaccine. And so what we were charged with doing is that 1A category. Everyone's heard about the categories. So 1A category really initially included nursing home residents and healthcare workers. So we have over 4,500 employees at UPMC. We received about 1,000 doses. So you can imagine throughout this, we've had to really apply stratification, risk analysis, who's most at risk. And so we have, over the past, 6 to 8 weeks at UPMC vaccinated now over 100,000 doses. Wow. We have over 90,000 employees. And so moving forward and in our senior communities, making sure that those are vaccinated within as well. Now we have the opportunity to move on to the other categories. So at the beginning, again, healthcare workers, nursing home, then those 65 and older in Pennsylvania was added. And so that was early January. So now we've really started to shift our focus now that we have vaccines available for those others in the 1A group. So now we're really being thoughtful about how we utilize those vaccines right now.
So you're not just opening the gates, everybody over the age of 65. You guys are starting at the very top. We're talking upper 80s, 90 years old, that group, that age category.
Absolutely. We know the mortality for that age group or the risk of dying from COVID is extremely high, especially if they get hospitalized. So we're calling those individuals. We don't want them to have to rely on internet or even friends and family out of state to continually refresh a website and then have vaccines. So we are really, our main focus is that we will not schedule someone unless we have a shot for them.
Okay.
We don't want to overschedule and have to cancel any appointments.
And I think that's really important information to pass along, that UPMC is calling the patients that they are able to vaccinate. So there's no need to call the hospital, which I'm sure you guys are getting a lot of. There's lots of frustration, though, surrounding the vaccination and the rollout here in Pennsylvania, and you guys definitely understand that. Let's take a couple of questions, and I thought this was an interesting one. This one is coming from where was it here? It was asking about waste, and this is something we've heard at least across the country, that the doses are time sensitive, and talking about waste and if there's been any in UPMC, that hospital system, that you know of.
Yeah, so we have not. We've been very diligent about every syringe that gets filled out of the vials. We have the Pfizer vaccine.
Okay.
When we compound that, we expect to get a minimum of 5 doses out of each vial. Sometimes we can even get a 6th, and that's allowed. So every dose, every vial that is pulled up gets used. We even, just to share a story, our director of emergency medicine, they had 11 doses left, so they drove around to fire departments to make sure that people, so we have not had one syringe with any vaccine ever go to waste.
I think that's some good news, as a lot of folks in the area are looking for that vaccine. And that question was coming from Sarah Jane about waste. And she was also asking what you guys are using, mostly Moderna or Pfizer, and you said Pfizer.
Yes, we have received 100% of our vaccine has been Pfizer.
Okay. Talk about side effects. We've heard a lot lately about that second dose hitting people perhaps a little bit harder than that first dose. What have you guys been hearing from your patients about that second dose?
So far with all of our staff and the patients, the first dose does seem to be a little more mild side effects. Myself, just some fatigue that evening. The second dose, which comes with the Pfizer vaccine, 21 days or later, we are seeing anywhere from 1 to 3 days of some mild symptoms. And again, not for everyone, but we will see individuals complain of a low-grade fever, some body aches, fatigue. And so we are actually capturing all of that data at a system level so that we can be more informed moving forward.
Okay, I think this is an interesting question. It's from Kim. She says, please confirm if folks must wait 90 days post-positive diagnosis to get the vaccine. I think that's very interesting. Should folks who have already tested positive be seeking out that vaccine?
So originally, this was part of some of the recommendations that if you had COVID, you could wait 90 days. Now, it is completely safe to wait 90 days because we do believe that you have at minimum 90 days post true infection of, self-inferred immunity. But it is safe now. Once fully recovered from COVID, our employees are able to get the vaccine. And again, we want you to be fully recovered just to make sure that any side effects or symptoms you have from the vaccine aren't related to the previous illness. So, a couple weeks, 1 to 2 weeks after being fully recovered, vaccine is safe to receive that first dose.
There have been some reports of folks testing positive after they have received at least that first shot. So what do you recommend to folks who may be in between shots? It's important not to let your guard down.
Absolutely. So just because you get that first dose does not mean you are fully immune. You can absolutely be exposed in that 3 or 4 week period between doses. So if you develop symptoms in that time, we 100% recommend, even with the mildest of symptoms, that you get evaluated. If you do test positive, you can receive the second dose. Again, we want you to be fully recovered from the COVID after the fact, but that is definitely possible.
Another question coming in on Facebook, and again, we invite all of you to hop on and submit your questions to us if you have any regarding the coronavirus vaccine that perhaps Emily Shears from UPMC Hammett could answer for you this morning. This question, are there any reports of severe reactions to shots, at least that you've given out at UPMC Hammett?
We have not. We've been fortunate. We have not had anyone with anaphylaxis or any severe reactions. Across the country, I know you can imagine with millions of vaccines that these rare events will seem more frequent. However, they are really on par with other vaccines and reactions. But we have been fortunate to not have anyone have any of those anaphylaxis reactions. Now, if you have any allergies at all that may cause anaphylaxis, they do recommend before any vaccine, please talk to your physician about that in terms of what the ingredients for the vaccines are, just to make sure that you're not at risk.
Okay, Emily Shears from UPMC Hammett, Director of Infection Prevention, is with us this morning answering your questions. This is one that actually our Elena Jonathan is working on. She's working on a piece that is on Erie News Now on the air right now, but we'll bring it to you. Pregnant women and the vaccine. Talk a little bit about that. And this question by Sarah Jane on Facebook.
Yeah, so far CDC has said that it is completely safe. And they are recommending pregnant women to be able to get this as a routine vaccination with no concerns. Again, if you have a history of any other concerns with vaccines, that's definitely something to discuss with your OBGYN. But right now it is safe for pregnant women to receive both doses of vaccine.
And what do we know about kids and the vaccine?
Well, the Pfizer and Moderna vaccines right now have not been studied. You can understand those usually doing children studies are very sensitive. So they're not recommended for those under 18 and Moderna, I believe, under 16 right now.
Okay.
So those populations, again, are very low risk compared to the older generations, usually very mild cold-like symptoms, if any symptoms at all. And so right now they're just really not in the mix of vaccines. And, as we move forward and with different strains and things like that, I just predict that likely this will become potentially an annual vaccination that we get, most likely having multiple strains of coronavirus, just similar to how we have multiple strains of influenza in the vaccine.
This question coming in from Mel, she says, will people be able to choose which vaccine brand they can get? So are people able to choose between Pfizer and Moderna?
So right now, the way the state is distributing vaccine, we don't have a choice what we get. So really, it will be whatever your healthcare provider has supply of. We're not aware of individual suppliers getting both vaccines.
Okay.
It has been typical that Moderna has gone to long-term care because the storage requirements are much less. It doesn't have to have that ultra-frozen environment that the Pfizer does. So most hospitals and healthcare systems with that ability, we have been getting the Pfizer just due to the ability to store it at the optimal temperature.
Okay, great questions coming in. So we invite you guys to get on Facebook, or you can post them in the comments here, and that's kind of what I'm going through now. Why can't the vaccine same day as allergy injections?
So with any shot, that's a really great question.
It's coming in from David.
So other vaccines, so for example, older individuals with things like shingles vaccine, we want those to be 14 days apart. So any shots, any injections that you're getting, which I don't have a full list, but obviously we want you to talk to your physician. So if you are scheduled for allergy injections, it's most likely because your body is mounting an antihistamine or an immune response to those allergy injections. And so to bombard your body with two different things that it needs to react to just may put you at higher risk for, maybe a higher risk of reaction.
Okay, talk a little bit about the behind-the-scenes effort over at UPMC Hammett and the vaccine distribution. When do you know how many doses that you're getting in? Do you get that information weekly, daily?
So usually that information, we can put in requests for doses, and those may or may not be filled, and when they're filled, they let us know. So I think it's been variable. Obviously, we're ready and willing to take on a large-scale effort, but we're utilizing whatever extra vaccine we get at the point. So our team has been focused on that, and obviously at a system level and at a Hammett level to make sure that as we come in and get those 1A categories fulfilled, that we're shifting that vaccine to the community now.
Okay, and we should mention that UPMC Hammett, they are focusing on the older set, obviously. The state did open it up to 65 and older, and I think that caused a little bit of confusion, opening up to that age range, not noting that, there's really not enough vaccine available for that age range. So I think that caused a little bit of confusion when the state announced that a couple of weeks ago.
Yeah, absolutely. There's 21 million healthcare workers and over 3 million individuals in nursing homes. And that was back in December. And the state's getting, 150,000 vaccines a day, roughly. And so when you add on a group in Pennsylvania, which is much older state population than most states, that adds an additional 3 to 4 million individuals when we open it up to that, 65 and older. So we didn't have 3 to 4 million extra vaccines at that moment when the announcement was made, which is why, there's been a lag in making sure that the vaccine comes through for those individuals.
Okay. Sarah has a lot of great questions, and we appreciate it, Sarah. She's asking, can PA residents get vaccinated in New York?
That's a great question. I don't have the answer to that. I would reach out if you are a PA resident. I would assume that if there are vaccines in New York, if you're able to get a vaccine, what we do recommend is if you're in a risk category or if you're in those higher, older age groups and you're able to get a vaccine, do that. Everyone's going to have different parameters for who they're allowing to vaccinate. Now,
can someone from Erie County seek out a vaccination in Crawford County? Is there any?
I don't think there's any parameters around that. I think it's just whoever's distributing or giving that vaccine, what their parameters are and what they're held to. This is obviously a very tightly regulated process. Every person that gets a vaccine goes into a database to basically say this individual received this vaccine. And also for tracking, we have to give everyone a second dose.
Right.
So you can imagine the logistics. So if you're, again, able to get a shot one place, you have to make sure that you can get the second shot there as well.
Patience has been something I know health officials have really been pushing, and I think for folks who are perhaps in that high risk group, that can be difficult, and it certainly has been a frustrating process. But Emily, we really appreciate you being here this morning and getting some of these questions answered. Can you think of any group that should not get the vaccine, or is any group being advised to stay away from the vaccine at least for now, other than kids?
Yeah, children right now, other than that, just if you have known severe anaphylactic allergies,
Okay.
that is really the only group. Obviously, younger individuals now will be later in the process than older individuals, but there haven't really been any announcements of groups that absolutely should not.
Okay. Tim Baldwin asks, will people who got the shot need any more down the road? That's a really good question on how long these vaccines are going to protect folks.
So we're going to learn that information together, Tim. We assume it's going to be likely an annual. We're making that assumption because usually vaccines can have the body ramp up that immunity, but over time it can decrease, which is why we need to even get tetanus shots every 10 years or 5 years, et cetera. So we assume the immunity will be stronger and longer lasting than actual natural COVID disease. So if you have COVID infection, you recover, we know that you're going to be immune to that, but not likely for 12 months. but we do have hopes that the vaccine will last that long. So we do assume that this will become really part of the routine recommended vaccine schedule.
Jump onto our Facebook page. Well, you're on our Facebook page if you're watching now, and you guys can really just go under this this live here, right in the comments, and submit your questions. This is what I'm looking at now, some that are posted on here, and we really thank you folks for jumping on. And this is what we're dedicating the day to, getting some of these questions answered. Let's see the ones that we have not touched on. Sarah's asking, we've heard of vaccine jumping. Now, that's most likely a problem you're not dealing with at UPMC Hammett because you are calling folks who need to be vaccinated.
Yeah, I think we've heard, obviously people are excited and really want to get this vaccine. So we know people are signing up on multiple lists. There's going to be retailers. We know pharmacies are going to be starting to offer vaccines. So I think that there's different opportunities for people to get out there. We're making sure that our patient population that is at the highest risk, we're going to be methodical about how we go through that. So we shouldn't have any vaccine jumping because we're just really sticking to it. It's a very regulated process, as mentioned. So again, starting with 90 and older yesterday, making those calls, and then we'll start to kind of progress down in the age group, and also individuals that meet certain high-risk categories or those in vulnerable communities or less fortunate communities in terms of the rate of COVID. So maybe certain areas are having much higher rates of COVID, high-risk individuals in that area throughout the Commonwealth with UPMC. Those are the individuals that we want to make sure get that vaccine first.
Now, when you call somebody who perhaps, there's a vaccine available for them in that older age set, upper 80s, low 90s, are you scheduling for that day? Are you scheduling for a few days out? How quick is the turnaround? Oh, okay.
We will be scheduling most likely the first available.
Okay. I think, we're going to go live here. Yeah, hey Mark, we're having a great conversation on Facebook Live, and we're still on Facebook Live this morning. We had to kind of break for just a second, so the folks who are still watching, we're going live right now on Erie News Now Sunrise. We've had a lot of great questions come in about vaccine availability, about symptoms, about where you can get the vaccine if you live in PA and perhaps you want to get a vaccine in New York. So again, we thank everybody who's jumping on and asking some of these questions this morning. And we're inviting you to head on to Facebook and submit your questions. It's kind of the easiest way that we can get those in real time and have those answered. Emily Shears, the Director of Infection Prevention over at UPMC Hammett, we thank you again for being here. We were just talking about the folks at Hammett, they are reaching out to patients that they have a vaccine for. So they are calling those folks. We kind of abruptly stopped, but talk about the turnaround when you call somebody, how quick they're able to get that vaccine.
Well, we're making sure that we get a hold of individuals when we know we have appointments either the next day or within the next few days so that we can schedule. And as we ramp up with more vaccines, we'll make sure that people have enough time to plan to get that vaccine. So as we offer more and more time slots, we'll make sure that we get those high-risk individuals scheduled.
And some of the interesting questions I think that we've already touched on, if you've had COVID, you can still get vaccinated.
Absolutely. We want to make sure you talk with your primary care physician and that you're fully recovered, but that first dose can be given again, within a week or two of being fully recovered after having COVID.
Somebody also asking on Facebook, are you able to choose which vaccine you're able to get, Pfizer or Moderna? The folks at UPMC, you guys are administering the Pfizer vaccine.
Correct. We will administer whatever brand vaccine that we get, and whatever's available is likely what patients will be offered. Unfortunately, right now we don't have the option of either vaccine.
All right, we're continuing this conversation as we have for the past 26 minutes here, Mark. We are live on Facebook, so we invite you to head over there as well if you do have a question that you'd like to get answered. We thank Emily Shears for being with us this morning. Mark, we'll send it back to you, and again, we'll continue this conversation on Facebook Live. All right, we'll continue the conversation here. Another good question coming in. Should people call ahead and confirm appointments before they go? Let's say if you have called someone, you've set up an appointment with somebody at UPMC Hemet. Should they call back and confirm?
The information will all be given on the phone. So if that's a question you have for the individual that gives you a call, they should be able to give you those instructions specifically about your scheduled appointment. So most likely once we confirm an appointment, that will be the date and time. Again, we did our soft launch yesterday, and so we're working through all of that, all the details. But again, if someone does call and schedule, that will be your date and time.
Okay, and keep in mind, we're going to be kind of going back and forth in the next 5 minutes here from Facebook Live onto Erie News Now Sunrise. So stick with us if you are watching us on Facebook Live this morning. A couple good questions here. How long before symptoms appear? I would assume they're talking about side effects after the dose. How soon are those starting to pop up? And we're talking about things like fatigue, perhaps a low-grade fever. That's what we've been hearing.
Yeah, typically we'll see a symptom post-vaccine dose within 12 hours or so.
Okay.
And fortunately for our employees, as we've given thousands of doses here, if symptoms persist or increase in severity, you should contact a physician. But really, those symptoms, on average, are about 24 hours. Should not go any longer than 3 days.
Okay. I'm just listening to my director here. Okay, Mitch. Thank you. Sounds good. This is a great question coming in on Facebook from Judy. She says, are there risks involved for people with bee sting allergies?
That's a great question for your doctor. I have not heard that.
Okay.
Doesn't mean there aren't any reactions. But if you do have any, again, anaphylaxis reaction, a lot of people do to bees, that is something they want you to check with your physician before you would sign up to get a vaccine.
So definitely make that known to your primary care physician. Good stuff there. Judy, thanks for the question. As we wait to go live on Erie News Now Sunrise, Emily, talk a little bit about what it's been like coordinating this effort over at UPMC.
Well, I have to give the credit to our Director of Emergency Management and Operations. Jason Chenault has really taken all of this work, and it is a monumental feat. You can imagine timing the doses 21 days apart, trying to reach all employees, finding out who wants the vaccine today, or maybe who says no today but yes tomorrow, and then coordinating all of that. The registration process for the government, again, tracking every single dose to be very diligent with that and responsible, is no small feat as well. And then making sure that as they add these higher risk categories that we have plans for the future, which is what we're rolling out now. So it's been endless work for them. And we mainly did that out through email to our staff, which was successful. Had some hiccups, but overall successful.
This question coming in from Tim. He says, will these shots put an end to wearing masks?
So not in the immediate future. We all hope that we can get back to, our normal routines, excluding masks. But right now we recommend 100% wearing masks, social distancing, avoiding large gatherings, even if you're masking. Exposure criteria, again, just to remind individuals, is if you spend 15 minutes with someone within 6 feet and they end up developing COVID, you are exposed. So those quarantine practices, those isolation practices are still very, very important.
Okay, I just wanted to make sure they weren't going to go to us on Erie News Now. Thanks for joining us here on Facebook Live, everybody. We're hoping to get as many questions answered as possible this morning. Wesley's saying, I'm a medical officer on a transatlantic merchant ship, but can't navigate the Hamet website to sign up for a vaccine because I don't work for a local medical facility. Where should he go? your advice?
We do have a website. It is upmc.com/healthcare vaccine. And we can get that to Erie News Now to post on this website. But if you search healthcare vaccine UPMC, we do have a website that your company can sign up for.
Okay, these are just some of the questions that we are going through this morning. So thank you, everybody who's posting. We touched on this a little bit, JR. If you've had the vaccine, can you still get the virus and transmit it to others without even knowing you had it?
So we are learning that. That's going to be very well studied upcoming now that we're having individuals vaccinated. So we had spoke about this a little bit this morning, but basically, if you're vaccinated, if you get the first dose and the second dose, and you're more than 7 days from the second dose, we would consider you to now have that full immunity. If after the 7 days from your second dose you do develop symptoms, we still want you to get those checked out.
Okay.
The vaccines are 95% effective, so that does still mean 5 out of 100 people could have breakthrough illness. And so that's, again, not a small number. And so if someone's exposed, we want you to get checked out because you may still have COVID.
And it's important to note the Pfizer and Moderna vaccines, they're 95% effective. So there is still that little bit of wiggle room. And as you mentioned, a pretty, when you're talking about, millions and millions of people across the country.
Absolutely. It adds up.
Yeah, definitely. Darcy says, I've had a first dose as an EMS volunteer. Can I get a second dose at day 19 or 20?
So with Pfizer, they have recommended day 21 or later. Day 20 is not going to cause any major concerns, but we do recommend sticking with the vaccine recommendations, which is day 21. So there were individuals at the early onset that were getting vaccine a couple days early. It is not causing any other concern, but we do recommend 21 and later.
Mary says, she talks about calling people to come in and get the vaccine. You guys are calling folks who are in that upper age set that are registered with Hammett.
Correct.
Okay.
We are going through our medical record to pull out those individuals that have been registered and have seen their physician within UPMC in the past 18 months.
And so it's important to note here, we have Emily Shears, Director of Infection Prevention from UPMC Hammett, and she can only speak on to the vaccination efforts over at Hammett. And we appreciate her being here and providing that insight for us this morning. Let's see, you guys, we have questions really filtering in this morning. If you get your first shot, let's say at UPMC, because again, this is what Emily can refer to, are you guaranteed that second shot?
Absolutely. We will not give you a first shot unless we know we have a second shot. We have not had any concerns with the second shots supply. Those are coming in. It's getting more doses of the first shot.
Okay.
They are the same dose.
Okay.
It is not a different vaccine the second time. It's the same one twice, but we have not had any issues, and we will not, again, do that unless we have both doses for someone.
And this is a bit of a concern, I think, that's been largely dispelled. But touch on this, Emily. When you get the vaccine, you are not being injected with any COVID, any of the coronavirus.
It's a messenger RNA vaccine, and really what it does is it sends a tiny little message in RNA, which again, if you go back to biology, 2 strands of RNA make up our DNA. And so it's a little message for your body to make something, and it's to make basically something that will disable the COVID virus. And then your body gets rid of it. So it's not something that stays in your body. So I know that's been a concern, but your body it basically dissolves out of your body after it's done its job.
Okay. We're going to stand by because we are going to join Mark Soliday on the air on Erie News Now Sunrise coming up in just a few seconds here. So stay tuned, everybody who's joining us live on Facebook. Stand by because we're answering more questions. We're just going to join programming on WICU and WSCE. So stay with us here and we'll get to more questions in just a second. Yeah, they're coming in, Mark, faster than we can get them answered. And I think that's a good thing. And we thank Emily Shears from UPMC Hammett for being with us this morning. We've talked about Mike is asking if you get your first shot, are you guaranteed that second shot in 2 or 4 weeks? Emily's saying over at UPMC Hammett, yes, they're making sure that if you get that first shot, you will have a second. I thought this was interesting coming in from Shelby. Why would anybody who had tested positive and recovered need a vaccine? Isn't natural immunity enough?
Well, we are assuming that natural immunity will wane faster than a vaccine immunity. So if someone has COVID, we assume immunity for at least 90 days, but with the vaccine, we're going to assume close to 12 months.
And this is a question that we touched on and answered a little bit ago on Facebook Live. Has there been problems with cancellations or spoilage?
We have not had any issues with spoilage. We have not wasted 1 dose of vaccine. We make it as needed. That's prepared in a pharmacy, so we're not wasting. And we have not done a mass vaccine campaign yet, so we are not dealing with lots of cancellations. We know individuals really want this vaccine.
Yeah, that is for sure. We have dozens and dozens of comments coming in on Facebook of people who are interested in the vaccine and want it. We invite you to hop on and do that as well. Let me get a few more questions in that we haven't answered yet. We've been having a lot of people ask, and I thought it was a good one earlier. She asked, what should folks do if they have an allergy to bee stings? And you would answer this on Facebook Live.
Yeah, really, anyone with any history of anaphylaxis or severe allergy reaction, before you get this vaccine or any vaccine, we want you to talk to your healthcare provider to make sure that any components of that vaccine would not cause you to have that reaction.
All right. So, Mark, we're continuing this conversation on Facebook Live. It's been a really great conversation going on, 40 minutes now. It's all about answering those vaccine questions all day long. We're dedicating this entire day to that effort because we basically know there's a lot of questions out there. All right, so let's rejoin Facebook here. Emily Shears, Director of Infection Prevention, joining us. And thanks to everybody who's sticking with us on Facebook. We're answering those vaccine questions that you guys have. And we've had some great questions here. Let me see. Emily, what's the most common question that you guys are getting to perhaps folks who are in to get the vaccine? What are they asking when they're getting that shot administered?
I think people are curious about side effects, which we've talked a little bit about. The first dose usually much more mild, if any side effects, maybe just some slight fatigue. The second dose, people are concerned, again, what to look for. So again, may have a mild fever, body aches, may have just some of those mild flu-like symptoms for the first 1 to 3 days. So just be aware of that. Be aware that that may be a reaction for you after a second dose of vaccine. And that's really just because your body is mounting a response. So that's a healthy reaction to have. That doesn't mean anything's going wrong. It actually means your body is mounting that correct immune response.
So a good thing, really, if you're having those mild side effects, unfortunately, could cause some discomfort for a little while. And by most accounts, that lasts, 12, 24 hours?
Yeah, we're seeing those mostly resolve within 24 hours. Most individuals feel much better after a day if they receive that. And again, that's not going to be everyone.
Karen is saying she's talking about some frustration. She has a mom who's 87. She's contacted CVS and Walgreens. Again, Emily is with UPMC Hammett, so she can only talk to their vaccine effort. But you must be hearing from a lot of people in the community who are really frustrated. They want this vaccine. Their lives have been, essentially on hold for a year or so. You must be hearing about this frustration.
Yeah, everyone, we empathize. We understand. We want this over. We don't want patients to be hospitalized with this. So getting the vaccine out as quickly as possible. It's hard to speak to other approaches. We have not focused so much on internet lists because we want to make sure if we call someone that we have a dose for them. And so we have, again, started with that highest risk category, 90 and above was the call starting yesterday, making sure that we get those individuals on the phone. And so, again, we will leave messages, we will email those individuals. And more information will come. As we get more and more vaccine, this will, we will all learn, we will have more available opportunities.
So again, UPMC Hammett being very methodical in their vaccine distribution, starting at the top, the oldest basically patients that they have registered in their system.
Yeah, we just don't want people that are only tech savvy to be able to get on and refresh and refresh and refresh. We want to make sure that if there's a higher risk person that they get the dose.
This is an interesting one coming in from Corrine. She's asking, should you get the vaccine if you've never had the flu shot?
Absolutely. They're two separate illnesses, two separate vaccines. So again, we would recommend that you receive both of them. But absolutely, COVID has been much more rampant. Obviously, no one is really immune to that unless you've had illness or now had the vaccine. So don't make an assumption that you're really not at risk for acquiring that. And then influenza right now, we're just not seeing any influenza in the area, and that's just worth to mention. We are testing for influenza and RSV, which are normally this time of year very common.
Sure.
And we're not seeing any influenza. So we're thankful. We do think that is in part to vaccinations, and then the masking and distancing affects that respiratory virus as well.
Julie, I think it's just showing some of the frustration. How do you get an appointment? Emily is with UPMC Hammett, so we've talked a lot about this. They are calling patients that they have in their portal who are the oldest. Other than that, I mean, health experts are referring you to your primary care physician or doing that kind of internet lottery game that a lot of folks have been playing, unfortunately, right?
Yeah, so Julie, if you're a UPMC physician patient, they will reach out when they get to your category. And so we want to make sure, again, if you can get the vaccine somewhere else through other avenues, we recommend that. We want everyone, if they have the opportunity to get a vaccine, to get it. But if you are in our network, we will reach out to those individuals in a very methodical way.
So is there a straight answer for you, Julie? How do you get an appointment? Is there one way? There's really just not at this point. And that's why I think a lot of health officials are urging patients. This is unprecedented, and we're fairly early on in this effort. And I think it might be frustrating for folks to perhaps hear from friends or family down in Florida or in other parts of the country who, maybe 55 and have already got that vaccine.
Absolutely. Every state has really been charged with coming up with their own plans. And so every state has come up with their own plans. Some states it's much more accessible, or it's done by county. In Pennsylvania, it's really, so far, they've been asking healthcare systems to do that. Obviously, retail pharmacies are now brought on as another distribution point. And just, we are so used to going to a physician's office and then pulling a vaccine straight out of the fridge, because there's usually a known number of individuals that get the influenza vaccine every year. So production is very well planned and timed. This is really, they're making it as fast as possible. They're distributing as soon as they make it, and then we're going to give it as soon as we get it. So again, there is a little bit of a bottleneck here in terms of just how much can be produced day to day.
Yeah. And we thank everybody for jumping on and submitting those questions this morning. Let me filter through a couple because they're really coming in fast. Joe Johnson, Emily, you have had the vaccine.
I have had the vaccine.
Okay.
Yes.
Yeah, so we do want to stress that. She has had the vaccine, and she is giving advice on it this morning. If you have an autoimmune disease, should you talk to your doctor before getting the vaccine?
Absolutely. This is a really great time to dialogue with your physician about what your risk factors are. If the vaccine's recommended for you, if it's not. Obviously, those with any immune compromised conditions can be at risk for certain illnesses. So vaccines, I'm assuming, would be tailored per different disease categories. So yeah, great conversation to have.
Okay, Emily is from UPMC Hammett, so again, only can touch on the vaccination effort that's happening there. A pretty good question coming in from Scott. He's asking, what number will come up on caller ID if Hammett is reaching out to a patient?
Scott, we started these calls yesterday and the day before, and
okay.
I don't have that information
Interesting.
yet, but that's a really great question. Most likely, I'm assuming it may come from a Hammett number, but we're calling from our UPMC health plan number. So whatever their caller ID is, but maybe we can get that information out for you.
Scott is also asking about the percentage of folks in Erie County who have had that shot. We're tracking that on our vaccine dashboard, and you can find that on our website, erienewsnow.com. I believe it's /vaccine. And there are numbers showing who's had the first dose and who has been fully vaccinated. So, Scott, you can check that out there. Bonnie's asking, should latent TB individuals, tuberculosis I would assume, get the vaccine? Wondering because COVID, affects your lungs and respiratory system.
I would assume that is safe. Again, you can talk to the Erie County Department of Health tuberculosis unit nurses or your family physician. But if you've had treatment for latent tuberculosis and you're recovered and you're done with those months of treatment, I don't see why you wouldn't. Again, great question to protect those lungs. That sounds like that would be totally indicated, but again, have that conversation with your physician.
And when we were first getting the vaccine doses, you're looking at some of the questions that we're going through this morning again on Facebook Live. When we first received those doses of the vaccine, they were obviously going to those frontline healthcare workers. Is UPMC making it mandatory for those workers to get vaccinated?
No, we are not making it mandatory. We have had roughly 80% of employees respond and get the vaccine. Again, at the beginning, the way the emails went out, people were able to decline at any time and then opt back in. So a lot of people, when it was new, we wanted to make sure that our nursing staff, our physicians, a lot of us that are not in direct patient care, at the beginning held back to make sure that those frontline workers that have really just put in blood, sweat, and tears into taking care of these patients, that they got those first doses. And then really following suit, at any point an employee can opt in, but it is not mandatory. We don't foresee this becoming mandatory in the near months as well.
Okay. Ori's asking about teachers being prioritized. That's obviously a question for some state reps. Emily is joining us for this hour, and we're going to have experts in health professionals from all across the area joining us here on Erie News Now live on Facebook as we head throughout the day. So if perhaps you have some questions, outside the UPMC realm, stay tuned. Again, we're dedicating all the way up to 11:30 tonight answering these questions for you live. And again, we thank Emily for being here this morning. Let me see. We've kind of already touched on that. Yeah, we talked about the autoimmune disease. Mary says, I've read many places that you should not take any anti-inflammatory before getting the vaccine due to some interference.
So there's been mixed media on this. So basically, the recommendation is that they think there may be a possibility that taking Advil or something like that may limit the immune response. So you take Advil as an anti-inflammatory and antibody response. And so, again, that's a personal decision. We don't think it will drastically affect the reaction of the vaccine and how your body will respond. But again, that's something that if you research that and don't feel comfortable, you don't have to. Again, that's just for symptom alleviation. So not necessary to take those antipyretics, something like Tylenol or Advil following. But again, that's an individual's choice to take that to alleviate maybe any mild symptoms after a shot.
Is there any sort of precautions or something that folks should do before going to get a vaccine? Should they not eat breakfast or, things like that?
No, everything would just be routine like getting any other influenza vaccine. Okay. We obviously observe individuals for, 15 minutes just to make sure there's no reactions following that shot. But everything would be routine as getting any other vaccine. Now,
is that the second dose, is that like more of a booster shot? Or is that, talk about the second dose and its use.
So basically the first dose primes your immune response to let your body know, hey, I started making this. The second one also challenges that. So it's putting more of that messenger in there. Your body sees that as a foreign and then reacts and creates another additional. So in sense, it is a booster. So that it boosts your level of immunity up to that 94-95% effectiveness.
Now, Johnson & Johnson, and we've been hearing a lot from them about their vaccine that we believe in the next few days will go before the FDA for that emergency use authorization. That is a single dose. Now, do you think that's going to help alleviate some of the vaccine frustration as we move along?
We hope so. The more vaccine that's available to the community is going to be better. Again, the more opportunities individual. And logistically, having one dose versus two doses will be much, much easier for healthcare systems, pharmacies.
Sure.
Especially those individuals once you get You know, if you don't have a primary care physician, being able to go one place, one time to get a shot is going to be much easier.
Darcy's asking if you've had a reaction with dose 1. I've heard the reaction with the second dose may be worse, and we've touched on that a little bit. It seems like folks are having more symptoms, or perhaps less mild symptoms with the second dose, if that's probably not the best way to put it. But
yeah, and not everyone. This isn't everyone. We're talking about, you know, a kind of a smaller percent of individuals. Personally, my arm was just extremely sore, and I was a little fatigued. I went to bed a little early that night that I got the vaccine, woke up feeling perfectly fine, feeling great from those extra hours of sleep. But really, the second dose is when individuals may have a little more extreme fatigue. Again, that maybe a mild headache, maybe some chills, mild fever, etc. So again, monitor that, but that should resolve 24, 48 hours.
And I think this is a good question for planning purposes. How long will the vaccine take if you show up from the time you get there to the time you're back in your car?
For me, it was about 3 minutes. We want to make sure you are who you say you are, who's been registered. We make sure that you're in the system. We get you sat down just like any other shot. It takes about 20 seconds. You know, we clean the skin, we give you the shot, but then that monitoring. We want to make sure that everyone's okay for at least 15 minutes to make sure they're not going to have any severe reaction. And
Emily, you've said, you know, within the doses that you've been administering over the past couple of weeks to your, you know, frontline workers and to that older set, you haven't seen any severe reactions within the UPMC system.
We have not had any that I'm aware of, any anaphylaxis reactions. Again, when you do millions and millions of vaccines within an 8-week period across the country, you're gonna hear of some of those, and that actually happens, you know, annually with other vaccines as well. So I don't think we're out of the, I guess, what would be expected range for certain individuals that might have that reaction.
Okay. We're getting ready to rejoin Erie News Now Sunrise, so stick with us here on Facebook Live and continue to submit those questions. If you already did, feel free to ask another question. That's really what we're dedicating this entire day to, is getting those vaccines, those questions answered for you, because as we've talked a lot about, there's a lot of frustration. There's more people who want the vaccine than the actual vaccine, at least at this point. So we're trying to get some of those questions answered for you. I think we have another minute or so before we join Erie News Now. Sally's asking, how long does the vaccine last in your body?
So it's a new vaccine. We haven't even had this vaccine out for a year, but we're assuming around 12 months or so. That's just the general speculation right now, that our bodies, based on the amount of the immune response, should last, you know, around 12 months. And again, someone asked about natural COVID disease. We assume that's at least 90 days. We don't recommend retesting for 90 days. That could be longer, and every individual is different.
Okay. Absolutely. Hi, Mark. Yeah, we were just finishing a question there, and Emily, I'll pose it to you again just so we can get our viewers that answer this morning. Sally was asking on Facebook, how long does the vaccine last in your body? And I think what's interesting regarding the coronavirus vaccine is there's so much unknown, and this is one of them.
This is one of them. This is a new vaccine, so we assume that immunity will be longer than if you actually get COVID. So that is an assumption we make, that you're immune for at least 90 days following natural disease. With this vaccine, we're assuming annually this may become a vaccine, but again, time will tell. There will be lots and lots of studies going on with that initial vaccine group that got it in the clinical trials, as well as the community now, just how long our bodies get that antibody response. And
we're continuing this conversation with Emily Shears from UPMC Hammond, and we invite you guys to hop on Facebook Live. We're going to stick around for the next 10 minutes answering those questions. So Mark, it's been really a great conversation, and it's not just happening this morning, it's really happening all day long here at Erie News Now, going through our 11 o'clock p.m. broadcast, so lots of time to get those questions in. Yeah. All right, we'll continue the conversation for a couple more minutes. And Emily, thanks so much for sticking with us this morning. Let's see. I'm not real sure. Stacy's saying, I'm sure this was asked and I missed it. Is it recommended to wait 90 days after having COVID to get the vaccine? And I did think we answered this earlier, but go ahead and repeat that one, Emily.
Yeah, absolutely. That's a great question. Initially, when this vaccine came out, that was part of the recommendations that, if you had natural COVID, that you would be protected. Right now, with just so few vaccines, it does put you in a good situation. We're not thankful that people got COVID, but really, you do have a 90-day buffer period. However, it is safe if you are able to get the vaccine once you're fully recovered from COVID to get that first dose. If you get a first dose, we've also had this question, and you get COVID in that interim, 3 to 4 weeks. So if you do get symptoms, we want you to seek medical care, one, to see if you need tested. But once you fully recover from that, even if you've passed that 21 days where you were supposed to get your second dose, maybe you're sick from COVID at that time, again, once you fully recover, you can get that second dose as well. Okay,
and a lot of folks have been asking about the second dose, and there's been reports from across the country of hospital systems, pharmacies running out of that second dose, so people are kind of left up to that one dose. At UPMC Hammett, you're working very hard to make sure that does not happen.
Absolutely. We will not schedule someone for a first dose unless we can guarantee a second dose, and we've had no concerns with that at all with our 90,000 plus employees across the Commonwealth in Maryland and New York that are getting this vaccine. And so that will be part of those projects and processes that they will definitely get the second dose.
Somebody's asking, is a slight decrease in efficacy in the J&J vaccine any real concern? I think it's, in the low 90s?
Yeah, so again, any vaccine at this point to really buffer the spread of the virus will be good. So again, if a vaccine's 90%, that does put a 10% risk. But again, the more people get vaccinated, the less likely you're going to get exposed to virus and have that 10% chance of kind of breakthrough illness. So again, any vaccine and any individual will be helpful with our efforts.
And again, the J&J vaccine not on the market just yet, expected to go before the FDA for emergency use authorization within the next couple of days. But yeah, I think it's promising for the vaccine effort, overall, getting more. Oh, thanks, guys. I'm not sure if I'm on. They're wishing me a happy birthday. It is my birthday, and they're saying I'm in the low 20s, so I'm going to stick with that. Yeah, right around my low 20s, guys. Anyway, a couple more questions that we'll take on Facebook Live this morning. Wesley, great question. Will the first or second dose of the vaccine trigger a positive result on a COVID test?
Yes, that is a great question. Absolutely not. This will not cause you. If you have a positive COVID test, you have COVID virus and most likely illness associated. So you're not being injected with the virus. You're really being injected with a little tiny bit of code. Think of it as code that goes in your body and tells your body how to mount a response against the virus. So you will not test positive. That's an excellent question.
That is a really good question. And I think they're taking us. Hi, guys. Thank you. Okay. All right. We'll continue this conversation for a couple more minutes. Becky's asking, is there any other news besides COVID? Yes, there is, Becky, but we're focusing our efforts today on the vaccine and answering those vaccine questions because as you've seen this morning, there's a lot of questions out there and really good questions, and we appreciate that. Deborah asks, how can I get on the list at Hammett and be called to get a shot? And I think a lot of folks kind of wondering that.
Yeah, and I think as we receive more and more vaccine, now that we're moving out of that healthcare arena, thousands of healthcare workers in the area, that was our main focus. And so now that those have received vaccines, we're moving all of our efforts towards the community. So we will be calling you hopefully shortly, especially because you're over 65 and you see a Hammett physician. That will be again, worked through in a methodical way to make sure those at highest risk do get called.
Now, that doesn't mean that folks like Deborah, if she does have a Hammett physician, can't seek out a vaccine elsewhere.
Absolutely. Again, we recommend if individuals are able to receive a vaccine through any avenue, again, you have to receive the first and second dose at the same place.
Sarah's asking, do you expect mass vaccinations as, the effort continues?
I think that's what we're really embarking on now. As soon as the vaccine comes out, we're going to be administering. So as soon as we get doses, those will go into the arms of individuals that need it. And all of our efforts will really be to flow the vaccine to communities now. So I think across the country, this really is the beginning of the mass vaccination effort.
Okay. Emily Shears, we've had a great conversation this morning. We really thank you for being here. We're going to end the conversation here on Facebook Live, but we do want to remind you this is happening all day long here on Erie News Now. We're going to be live on Facebook. We're going to be live on the air. There's actually a chance for you to call with questions coming up a little bit later this evening as we continue to go to the experts. We don't know the answers. You folks know the answers, and that's why we're relying on them as we head throughout the day today. So thanks to everybody for joining us this morning. Have a great day, and again, stay tuned as we continue with the vaccine questions and answers only here on Erie News Now. Thanks, guys. Let's see. Now the question's going to be getting out of this. I think I said, oops, cancel. Huh. Did that record out? You might be stuck here, Emily. I don't want to. I'll make sure we'll turn our mics off just so we can.